There I am. Hi. Good morning, everybody. Um, how great to be here and thankful for technology that gives us this opportunity. But I always like to say, as we say around here, buenos dias. It's great to be associated with all of these great panelists and great people. Today, we're going to, and thank you, Irais, for that introduction. It's great to be here again with you virtually. For those who've attended our events in the past, you know, human right to water is our basic goal here to get that enacted. But how do we do that? So we have some panelists today who are going to give us a lot of great information, food for thought about how we get the most vital resource that human beings need everywhere and anywhere after air. And let's start. I'm going to invite to the stage our first panelist, who is Gregory Pierce, and he is the Associate Director of the UCLA Luskin Center for Innovation. And let me go back. The next speaker is someone who has a very familiar name to me, Carmen Ramirez. And she is a board member of the Central Valley Regional Water Board. Last but not least is Anatol Falagan, Assistant General Manager for Long Beach Water. He's not right. I think he's coming in a little bit. He's not quite here yet. But as a reminder to everyone, each panelist will have 7 minutes to present, talking about water challenges in both rural and urban California. And then we'll talk, we'll get into a conversation and have a question and answers. So please put your questions in the Q&A box, and then we're going to get started. So I'd like to start with Dr. Pierce. So for everybody else, please turn off your microphones and cameras. Dr. Pierce, please take the stage. Thank you.
Well, hello, everyone, and thanks for that introduction, Carmen. And thanks to everyone for joining today. I'm going to speak briefly to essentially to focus on state-level policy efforts to address gaps in the human right to water in California, both in the rural and urban context. I do want to note up front that I think the role of local governments and local utilities is more important than the state or federal role, and you all do the work to ensure the human right to water on the ground. But again, I'm going to speak to state-level efforts, primarily because we've been quite involved in those, and California is unique in its real efforts to ensure a human right to water, as opposed, or I would say, over and above many other states in the United States. Could you move to the next slide, Brian? So just a little bit, again, I'm from UCLA. Luskin Center, we do quite a bit of work on water sustainability, water equity broadly. We have really 3 different focus areas. I'm going to talk to the first and the third today, the first being research to support policy and planning for the human right to water. The second being moving the region of Southern California toward local water resiliency, and as we have drought and as we have climate change accelerating. And the third is around urban drinking water quality, and particularly perception of drinking water quality, some of the issues that are fairly unique to urban areas that don't currently have robust policy solutions. Next slide. But before diving into a little bit about what the state is doing on the human right to water, I do want to define the human right to water and essentially say that the state does have a legislated human right to water that says every human being has the right to safe, clean, affordable, and accessible water. And if you follow the state's work, or the framing sort of the human right to water is always around 3 dimensions. The first is quality, safe and clean, affordable, and then accessible. And I'm really going to focus on the first 2 today. And as I noted, California is unique in having a legislated human right to water. I'm not sure any other state in the US does. There may be 1 or 2. The US does not have a human right to water. And the US is not a party to sort of the global human right to water efforts that are ongoing and have been for some time. Next slide. So the first thing I want to focus on is the state's efforts around quality, ensuring everyone has high quality water in the state. Of course, and when I say the state, I'm really focusing here on the state Water Quality Control Board, which has the regulatory authority from the Safe Drinking Water Act to regulate all public water systems. As many of you probably know, there have been sort of a set of systems, around 331 today, that are failing to meet the standards of the Safe Drinking Water Act, as well as additional California standards. But shortcomings in terms of quality are really concentrated in smaller water systems. So the state has more recently focused its efforts and new funding that it has available to focus on smaller water systems, those serving 3,300 connections or fewer, as well as private or domestic wells. Next slide. And what I want to emphasize is really a new-ish effort since 2019 that both mandates and gives the state additional authorities and funding to address water quality and water affordability. That was authorized by Senate Bill 200 and established the Safe and Affordable Funding for Equity and Resilience, or the SAFER program within the Water Board. It gave the Water Board around $120 million a year additionally to spend on water safety and affordability, and also allows for more flexibility in funding to pay for things like O&M instead of capital, as well as administrators and technical assistants, which previous speakers were noting. There's less flexibility depending on the funding source at the federal or state level. Next slide. And really the core effort of the SAFER program is being supported by a new assessment of both water quality and affordability called the Needs Assessment. We worked under contract with the Water Board on the inaugural Needs Assessment that just came out in March. You can see, if you would like, 500 pages of detail on what the Needs Assessment is, as well as a lot of the data that was used to generate the results. It's publicly available on the Water Board's website. But essentially, it comprised of three components: a risk assessment, a cost assessment, and affordability assessment. And what's really new about this effort is that it goes beyond simply looking at systems that have failed or are currently failing, to meet the water quality standards of the Safe Drinking Water Act Plus in California, to look at systems that may be at risk of going out of compliance, and also to look at private wells through new modeling efforts that the groundwater team at the Water Board has undertaken. And most importantly, I think for this audience, it doesn't just look at risk and at failure. It looks at solutions and costs and estimates the cost of both interim and long-term solutions to ensure that everyone has high quality water across the state, and estimates the gap between the currently available funding sources and what the state has at its disposal to fund solutions. Next slide. So again, there's a lot of detail in the report. I encourage you to look at it if you haven't, if you're interested. But again, I want to emphasize, and this is a table showing you sort of the types of solutions that were modeled for systems that were failing, both public water systems as well as small wells. And it ranges really from looking at traditional treatment technologies to physical consolidation to point of use, point of entry at the tap. So there's a lot of detail that the Water Board will be conducting this analysis annually, and also using it to prioritize the funding it has available, again, including the new SAFER fund, but also potentially including some of the additional funding people have mentioned from federal and state surplus sources that are currently being finalized. Next slide. I want to move on and briefly touch on affordability. There's a lot to say about affordability. Again, I would emphasize local water systems do the most to ensure that water is affordable, both in terms of source costs, of course, in terms of infrastructure, as well as in terms of rate structures. Where the state is focused is really on statewide, or is on low income rate assistance and ways to make water affordable over and above those source costs and rate structures, looking at bill discounts, and particularly looking at the issue of shutoffs and water bill debt. So we worked with the Water Board actually for 4 or 5 years to come out with recommendations for a statewide assistance program, came out in January 2020. But next slide. Since then, the focus and affordability, as all of you know, I'm sure, has shifted toward water debt and water shutoffs. We're still currently under a moratorium on water shutoffs, but we helped the State Water Board come up with its estimate of residential water bill debt. And as you know, and has been mentioned, now the state appears that it may have up to $1 billion to address the issue of water debt. And California had to come up with an implementation plan for solutions that really has a stopgap on affordability. Next slide. Last but not least, I do want to mention an issue that goes beyond largely the way that the state is looking at the human right to water, which is to focus on urban tap water distrust in disadvantaged communities. Here I'm referring not to places or where water systems are failing to meet primary or even secondary water quality standards, but where people still don't trust the tap. They're experiencing something at the tap. They're seeing something, discoloration, taste, smell, etc. It's not just a matter of misperception. There's probably issues coming from people's internal plumbing. And this is a space where, that again, leads to a lot of mistrust, leads to a lot of people relying on more expensive and less healthy bottled water, sugary beverages, where there's not clear policy solutions. So last slide. We've been doing a lot of work with local utilities, and I should say utilities both in Los Angeles, including LADWP and the CMUA, the Association of Municipal Utilities, as well as the Bay Area, and now in the San Joaquin Valley on potential solutions to this issue, including infrastructure solutions or sort of point of use filtration, piping, fixture solutions, as well as informational solutions, and trying to motivate potential state funding to address this issue, which is particularly prevalent in urban areas.
Thank you, Doctor. That's so great. So much information. I could listen to you for hours, but we've got to move on to the next speaker. I'll only mention that a lot of our immigrant community have historically not trusted what comes out, if anything comes out of the tap. So thank you so much. So I'd like to now introduce Carmen Ramirez. Carmen Ramirez, we have to start a club. There's a lot of us. So I'm going to turn it over to you. You're with the Central Valley Water, and you're going to tell us all about it. So everybody else, please turn off your camera and mics. Thank you.
So thank you for inviting me. And Carmen, I'll tell you that, I've done what I guess I'm not supposed to do. I Google my name, and I've seen your picture come up lots of times. And so I'm glad to finally meet you. First of all, thank you for having me here today. I enjoyed Dr. Pierce's presentation. I graduated from UCLA also, so it was nice to see him here. I'm going to be discussing the Central Valley Water Board, who we are, what we do, how the human right to water impacts what we do, and a new program that the Central Valley Water Board just launched, designed to help people in the Central Valley that are at risk for nitrate contamination. The Central Valley Water Board is, well, next slide, please. So first of all, the regional board, California regulates water quality through 9 different regional boards. So there's a maximum of 9 board members per regional board, and we're appointed by the governor and then confirmed by Senate rules. Each of our term is 4 years long. The Central Valley Water Board is the largest of the 9 regions, with a jurisdiction that stretches from the Oregon border to the northern tip of LA County. So it's about 60,000 square miles, nearly 40% of the state. It includes all or part of California's 38 of California's 58 counties. And one of the reasons that it's so important is that we do cover about 80% of all of the state's irrigated land. In total, water from the Central Valley provides more than 50% of the state's total water supply. It provides drinking water for 25 million Californians, and irrigation for millions of farms out in the Central Valley. The main duty of the Water Board is to protect water quality. So both in surface water and groundwater, we do this primarily by issuing permits to everyone who engages in activity that could have an impact on water quality. So that includes, growers, cities, municipalities, individual water districts, dairies, and so lots of different things. And even like corner gas stations and Air Force bases, right? Because we've seen sometimes that there's been leaches into groundwater. So that's our jurisdiction also. Next slide. So I'm not going to spend a lot of time on this. Dr. Pierce covered this, but California did enact a law that recognized the human right to water. Here in the Central Valley, our board adopted a resolution that declared that our board would take every action we can to ensure that water quality and pollution that can affect human health is eliminated or mitigated. And one of the programs that does that is through CV salts. So next slide, please. As Dr. Pierce said, one of the biggest threats to water quality in the Central Valley for us is nitrate pollution. In this map here, you'll see that, so the drinking water standard is 10 milligrams per liter, and these are highlighted in red. Elevated nitrates in the Central Valley are almost exclusively from human activities, and these have direct impacts on water quality supplies. Many areas in the valley that exceed nitrate, where the nitrate content in the water is also considered, a lot of these places are disadvantaged communities. So many people who live in this area have only these domestic wells or small water purveyors to provide water. And one of the risks is that nitrates are what we consider to be a legacy contaminant. So even if nitrate applications stop today, what we have in the ground now is about 50 years worth of nitrates that are slowly making their way down to the water table. And so a lot of people boil water, that's not going to help. So this is a problematic constituent for sure. Next slide. So the sources of nitrate pollution are also the same industries that are the backbone for California's, and especially the Central Valley's economy. Nitrate containing fertilizers are vital to growing crops in the Central Valley. In fact, growers all apply nitrates in some form because a lot of crops won't grow without that. So, however, it also contaminates drinking water. So even the most high-tech growers are trying to mitigate this. And some of the things that they've done is where nitrates have traditionally been applied to the ground or to the water. Now, because of partnerships that we have with UC Davis, we know that plants will uptake nitrates at different times in the growing season and at different rates. So growers have implemented this, and one of the things that they do is they apply directly to the leaves and only during a certain part of the growing period to make it less likely for this to leach into the groundwater. But again, as a legacy contaminant, what we're doing now is trying to prevent more, but what's there is still migrating down. There's no easy or inexpensive way to treat nitrates. For agriculture, the technology to comply with the drinking water hasn't even been invented yet. So as an agency that's tasked with permitting these industries, it's a tricky place for us to be balancing those interests. Next slide. So what the board has come up with is a nitrate control program. Under this program, all of the permittees, including agriculture, dairies, municipalities, have 35 years to develop solutions so that no more pollution will occur. This is an incredibly expensive process, but the work is being now done. But what about the people who are drinking water that's already contaminated by nitrates? Well, under this program, the human right to water, the board is requiring permittees to provide replacement water while they work on long-term solution. So the map that you see here is how we're rolling out the program. We're rolling it out in phases. We're targeting the worst hit areas first. So the areas that are highlighted in red, these areas in the Central Valley, we've already issued over 1,400 notices that will require permittees to start providing replacement drinking water under this program. The orange section, which are the next section, those notices are going out in 2022. Next slide. So replacement drinking water program, what we've done is we've done early action plans, and what they involve is community outreach. We've partnered with Spanish language television, radio, newspapers, community groups, so that these areas know that there's a potential that their water might not be safe. So we've done outreach, well testing, and replacement water. Replacement water can include bottled waters, fill stations, and point of source treatment for to treat for nitrates. Next slide. So I know that this conference is addressing people that are all over the state, but if you're in one of these areas or you serve an area that's in one of these areas and worried that their well could be impacted by nitrates, these are the general regions and their phone numbers. These are people that are familiar with the program, they know what to do, and we can get people out there fairly quickly to test the water and help get replacement water when they need it. Next slide. And I think that's it. So thank you again for your time. If you have questions that I can't answer today, I can certainly give you the contact of who to talk to, but I know that there's going to be a Q&A after this. So thank you for inviting me, and it's nice to meet you, Carmen Ramirez.
It's nice to meet you too. And Carmen, you have a big job. I really admire you for taking it on. Thank you so much. Our next speaker is Mr. Anatol Falagan, who is the Associate General Manager, do I have that right? The Assistant General Manager of Long Beach Water. I used to live in Long Beach, love Long Beach. Also another big job. Please, everybody else, please mute yourself and get off camera. Thank you.
Thank you, Carmen. Can you hear me okay?
Yes, we can hear you.
Thank you so much. And good morning to everybody. It's a pleasure and an honor to be joining such a distinguished panel to be talking about these critical issues. I was asked to give an overview on what the water challenges are given these topics in urban California. And I thought about it and thought about, you'll be presented with graphs and information and maps, and you just got an overview of some of the difficulties and challenges that the state faces. So I wanted to spend the brief time that I have perhaps giving you more a framework off of which you might engage or find yourself talking to people about these issues. If you can go to the next slide. So from an urban water supplier standpoint, I think from the information you've seen at our panel this morning, I want to just take a step back for a moment as to what this challenge is for an urban water supplier. So click once more. And so I was talking to a famous person one time trying to describe what our challenges in urban settings when water suppliers are delivering water. And I was going and waving my hands a whole lot. And this person said, you make sure we have water every day. And I think that from the perspective of urban water suppliers, we start at that basic premise. Now, this person was very famous to me. Click once more. They may not be famous to you, but they were definitely very famous to me. It was my son at age 4 back in 2005. So making sure that we have water every day puts then forth this context where we're facing challenges. Next slide. And there's 3 key challenges at least for urban water suppliers in California, diving back into this panel that we're on today. Click once. And that's access, right? The human right to water is fundamentally one of the critical challenges. Click once more. Quality. We're talking about any number of different aspects of water quality. In Southern California, in the region that I'm part of with Long Beach in Southeast Los Angeles County, PFAS has become a new constituent of emerging concern, CECs, and that also will require to be addressed. Click once more. And the other aspect is infrastructure that we currently have in place. Infrastructure has to be maintained, and if you don't maintain it properly over time, the very infrastructure that you're using every day can begin to pose challenges in terms of meeting your obligations to your customers. Next slide. So a framework for you to consider is that as you engage in discussion of these issues, or these challenges, I should say, the first thing that might come up in the dialogue, click once, is that they might tell you, well, you need to understand it's an issue or a problem. And I think humorous, but not so humorous, the reaction that we might find ourselves in is, how is this a problem? Human right to water is not an issue or a problem. It's well understood. I mean, how could you say that it's a problem? When it comes to quality, you would say, well, I mean, what's the problem with quality? If you're going to do safe, clean drinking water, it needs to be safe and clean. I don't see why that's a problem. Same thing for infrastructure. Click once more. The discussion can evolve then to the next level. Is like, well, you need to understand it's complicated, to which me being an engineer and being in urban water supply, in many cases, people might respond and say, I don't know what's complicated about it. There's engineering firms, contractors, they build pipelines, contractors operate systems. There's well drillers who drill wells. You can design treatment systems. It doesn't seem complicated at all. And that's perhaps why I offer you this slide, click once more, that the issue here, this challenge, is that what is before us is complexity. A lot of different moving parts that have to come into place to address these challenges. Next slide. So understanding this complexity. For me in my area in urban Southern California, groundwater is one of the foundational sources of meeting our customers' needs in terms of safe, clean, and affordable drinking water. The issue here, or the challenge, is that the groundwater is not all the same. Different basins have different geology, different structures. You heard about things in the Central Valley. Dr. Pierce gave you an overview of all the different systems in California. Not all groundwater is the same. So therefore, the quality is different. Click once more. So basins have different needs. And so one structure or one solution doesn't fit all. And that begins to add complexity. Click once more. In general, more and more, we're finding that the solutions here come forward in the form of treatment. And treatment requires infrastructure and it requires people. And so in order to address these challenges, inherently what we're talking about is that you need to fund, you need to build, you need to operate, and you need to maintain infrastructure. Next slide. Infrastructure, by the very nature of what we're talking about, means revenue. And revenue brings on its own additional challenges. Click once more. To generate that revenue, you need to charge rates. And rates in today's day and age need to be tiered. Increasingly, both from the government standpoint and regulation of utilities, more and more the pressure is to have tiered rates or rates that increase by the amount of use that you take on. We call these conservation rates. Click once more. At the same time, we have state law within the state of California, Proposition 218, that demands that the cost of service match those rates. In other words, we find ourselves with needs for infrastructure and needs for revenue, and the state law does not allow us to cross-subsidize in public utilities, one customer base subsidizing the other with its revenue. Click once more. So infrastructure needing revenue, in some cases, you're going to need to finance that. You're going to need loans, you're going to need bonds, you're going to need to use grants. And this combination of factors now begins to add complexity that you need to take on for this challenge. Click once more. And so to fund, build, operate, and maintain infrastructure, you need financial strength as an entity to come forward to do this. Next slide. So challenges also come with opportunities. And that perhaps is this emerging framework or this emerging forum of discussion, not only in Southern California, but throughout the state, where we find that suppliers, agencies, and institutions that were perfectly fine by themselves before, they now need to collaborate more to meet these challenges. Click once. And that's because each supplier has their own history, each supplier has their own infrastructure, each supplier has their organization, their people, and they also have their own finances, and they may not all line up. They may not all line up. So click once more. This element of complexity is what I call using the word and instead of the word or, because we can find ourselves wanting to just simply deal with only one of these, the infrastructure, the organization, or the finances. And when I say the word or, it just means you need to pick one. The challenge that we face throughout the state and in California, and urban California in particular, is that I'm using the word and, infrastructure and people, infrastructure and finances. That adds that complexity, and that really is perhaps an underpinning of the challenge before us. Next slide. So I offer you this framework in order to deal with all the different forms where you may find yourself discussing these and wanting to move into action, move into solutions, and find yourself with different ways in which they discuss these items with you. One final way to look at it is I'm often impressed by the nighttime wisdom I get in teabag sayings. And so one of the teabag sayings I'm going to borrow here and rephrase was, click once. The problem is not the problem. Click again. The problem is how you approach the problem. And click once more. So remember that and is sometimes the pathway to understand the complexity of what you're dealing with instead of or. Click once more. Thank you. I appreciate it and look forward to participating on the panel.
Thank you very much, Anatol. It's complex. Yes, complex. And thank you, all of you, for your great information presented. There's so many questions we have out there. And I'm going to ask you all to, yes, the panelists to unmute and turn your video on, and let's get going with some questions. And I have some in the chat. Keep putting them in there. We have about 15 minutes. One question for Carmen is about the Central Valley and their small water companies or mutuals, whatever. And there's some effort to get them to consolidate. Can you talk about that?
Yes, so we've seen that that has been an issue, especially in our area. We don't have enough engineers, and what happens is that these companies sort of are, you know, challenged by trying to get these same individuals. So what we've tried to encourage them to do is almost, you know, as a previous speaker said, where we use and instead of or, right? Not every purveyor has to have, you know, a chief operator, right? Because so much of the cost is through admin. And, you know, if you serve, you know, 75 people and you serve 100, you've got 2 CEOs, you got 2 boards, you have 2 operators, 2 sets of computers to maintain. And that's not very efficient for ratepayers. So we can't, as the water board, we can't come in and say, hey, you guys need to consolidate. But we do want to provide incentives for smaller, like water mutual companies or smaller districts, to find benefits to consolidating. Some of the problems that we see is that people almost treat them, and this is going to sound bad, and I don't mean it that way, but almost like they're a little kingdom, right? So they don't want to share sort of their authority or give up any of their control to have to negotiate now with another entity. But what I've seen is that's become less of an issue, and now I think that they realize that with water being such a scarce resource, the cost of having to comply individually, I see that the trend is towards more ands and less ors, but it's slow in coming.
That's complex.
Yeah, and I think that that's exactly what the previous speaker was
Yeah,
talking about.
so it's gonna take, people working together and for the betterment, for everybody's good. So good luck. I wanna, here's another question, very pertinent to the 218 question, Prop 218, which I've had to deal with on Oxnard City Council, where I was for 10 years. And I'll give this to Anatole. How can poor people and those on fixed income keep up with increased rates? Because we know it's going to cost more to fix our infrastructure.
Well, there's a couple of ways that it is incumbent upon water suppliers to work, especially the public-owned water suppliers. I'll give you one example. It's definitely not to say that it applies to all. But in Long Beach, with our rate structure, one of the things that we did is we have access to two sources of water, and one definitely costs more than the other. So one of the first things that we did recently is that we restructured our rates so that we put forth that the first level of consumption, which arguably would be for health and well-being, that first level of consumption, we would attribute it to our lowest cost of water, source of water, our groundwater. And so that brought the rates down a little bit. The other thing that we did was that, and again, it doesn't apply to all, but this is the type of creativity that you need. We had other sources of revenue. And so one of the sources of revenue that we have is just simply the fact that as the water department, we have access to certain lands that we own, but they're not really producing anything per se. So therefore we lease them, communication towers and other things. We put forth that lease revenue is not ratepayer revenue. And so therefore that's not part of Proposition 218. And so our low-income senior and low-income disabled programs that we run through the city, we offer those with that revenue as a base to provide those types of coverage for low-income seniors and low-income disabled. And in that case, we're offering a decent amount of initial water that is free for their use if they qualify for those programs. It's that kind of effort that I think needs to come forward from water utilities now into the future, where before, I think in the past 2 to 3 decades, people just simply went, and then I know they said it, they said, well, water's just really cheap. And so therefore it's affordable, it's not an issue. But going forward, you need to be creative and you need to find ways to do that. And finally, the other thing was what I often call is going to learn how to use other people's money. So trying to get state funding and having massive support for state funding at a certain level for a certain benefit to the public is incredibly important for water suppliers.
Thank you. Dr. Pierce, can you talk about some of these contaminants? Is that in your realm, the nitrate issue in the Central Valley and all of the other the PFAS? Is something you could discuss? That's a question here. How can we improve standards for contaminants, especially in urban areas?
Yeah, I can speak a little bit to it. I'm a social scientist. I'm
Right.
not an engineer or water quality chemist, but I think the question then is around how to bring on board standards for contaminants that are currently
Right.
being debated what the standard should be. I mean, I anticipate that, and I'm sure many of the participants here anticipate that for hexavalent, chromium, PFOS, PFOA. And I guess I think, to me, the challenge there is not so much whether those standards are going to be imposed. It seems likely they will be, but how to pay for them, because they're going, and frankly, for how some systems are going to be able to be compliant, because my understanding is if those standards were put in place today, many systems would be out of compliance. I'm sure no systems want to be out of compliance. They want to be serving water that meets the standards, but the cost of those treatment technologies for those contaminants is pretty high, and there's not a clear source of federal or state funding for those things yet. So I think that's really where the challenge lies, and unless we see reductions in cost of treatment technologies, there's no easy answer besides more federal or state funding to subsidize the increasing standards that are placed on water systems for public health.
Well, speaking about that, you know, the Proposition 218 does make it difficult to provide water at a cheaper rate for everybody because other ratepayers cannot subsidize. And I always think that maybe it has to do a lot with public education about what it costs to have healthy water, and how would you recommend that we as a society get people to understand that this is something we have to pay for?
Yeah, it's a great question. I think there is a sort of a disconnect between people hearing about a given contaminant and being concerned and wanting that to be addressed by their water system, even at very low levels, and not connecting that with the high cost that someone's going to have to pay to make that possible. So I think, I mean, part of it is just communication and planning around how much it will cost, and showing that in terms that people understand on a monthly or annual basis on their bills. But if standards are imposed from higher levels, then again, I don't think it's the communication piece to ratepayers so much as how the system is going to be able to finance these things. But to speak to your broader question, I think for the higher income or even the moderate income household, continued education that the price of water is going to rise for them, that reflects the scarcity, that reflects the increasing quality standards that are imposed, is just a reality. And that reflects our increasing intent to make water affordable for those who truly can't pay, and that water has been underpriced for a long time. And I mean, I think people have gotten that. That's better understood since the last drought. We're in another drought. I think that message is getting out again, but we're still playing catch up, in my opinion. So I know Anatol wants to say something.
Yes, Anatol.
Yeah, it's important. There is some aspect of the cost for water going up. That's true. To the point that I made about, loosely commenting and saying, my apologies to anybody in the audience that is with the state. I said using other people's money. There is an element that we have found recently in the current environment, where having a statewide focus more on climate change and sustainability and greenhouse gas emission reductions, much of the talk that we're having here on the panel revolves around groundwater, and groundwater is the local water beneath your feet. And so if we're trying to optimize these systems, doing so puts less pressure on what is a matter of fact reality that much of the state relies on imported systems, large aqueduct systems that take a lot of energy to pump and move water. And so there's an element there where there's a statewide interest in public health. There's a statewide interest in climate change mitigation. There is a statewide interest in sustainability that kind of puts forth the need for state level of investment in these solutions. And when you get access to that kind of funding, well done and well organized, that reduces the pressure on the urban water supplier or other water suppliers to have this money available. And then consequently, you see that effect in the rates. So that's one element of when I say these agencies and institutions need to collaborate, that's definitely one level of collaboration is at the state level.
Thank you. Hey, Carmen, it looks like you want to say something about this.
Well, I agree. One of the things, I serve on another board too, and the Lieutenant Governor was here yesterday, and she was talking about the importance of, additional dam building, right, and water storage. And certainly that's very critical where we are. But going back to what Dr. Pierce was talking about, what we see is that a lot of the technology necessary to do these load detection limits is so new that it's very expensive. So as these new technologies to detect these lower limit constituents, until that becomes more common and it's done more often, the prices are still going to be very high. So the good thing is that once they get better at it, it becomes less expensive, but the better they get at it, the more things we discover are also problematic. So what we want to do is we want to have water that's in as good a condition as we can have for future generations. And so that's what we want to do at the Water Board. And I'm glad to see how many other people are concerned about this as well.
You know, there's a lot of questions here. We won't be able to get to them all, but I'd like to give the three panelists here a minute each to give us a final thought after hearing all of this discussion and questions. We'll start with Dr. Pierce.
Thanks, Carmen. I did see a question on sort of the urban distrust, so maybe I'll close with that on potential solutions or things that local governments can do. I think the first thing I've seen, and the most important thing, is for local governments, whether they're the water provider or not, to just take concerns that residents have seriously and help residents navigate how to express those concerns and talk to their water system, talk to regulators if necessary to increase trust. That's the biggest step. There's also information around, you know, what is water quality, how to make that simpler, how to compare things to bottled water costs to make the disparity clearer. And then the final frontier I think we haven't gotten to yet is funding in that space, whether it's local government or state funding. So I'd love to see that and love to work with any of you all on that who are interested. Thanks for your time.
Anatol?
Yeah, two elements of that were here in discussion, what related to trust and the other one related to affordability. One of the aspects of affordability that I'm increasingly sensitive to is this aspect of that many times affordability, people will do all kinds of studies and they'll just take the bill and they'll say, well, this amount is affordable. And I'm more sensitive to the rate of change. And so it's not the bill itself. The bill itself could be fine, but a human being reacts to change. And so if the bill is going up at a rate that is very, very fast, that can lead to fear. And then fear can lead to choices being made in family budgets and so forth. So it's not just the bill, it's the rate of change of the bill. And there's another element to trust, because I inherently believe that water suppliers were in the trust business. But one of the elements, having grown up and lived overseas in Latin America, one of the elements of this trust in the government is not only the absolute trust, but inherently the belief that the government can let you down. So that the trust in the government is not an absolute thing. It's the belief that the trust in government is a continuous thing. That's another element that I think we deal culturally with some communities and their response or their belief in how the government supports them when it comes to water quality.
Right, thank you. Carmen?
Well, Carmen, I think that, you know, these gentlemen have kind of said a lot of the most important issues. You know, I agree with both of them. You know, when he's talking about ratepayers, I get it. But I've seen the other side, right? In the city that is close to where I live, they were so worried about rates that they didn't increase rates for a long time. And then they're deficient. And now they're facing this gigantic jump, which is really scary. And politically, nobody wants to take that on. So, you know, it's a hard place to be. But one of the things that I'm so pleased about is that water, the importance of water, seems to be an issue that's more common and people have interest in. So I think as long as there's engagement and understanding, I think that that'll lead to people being willing to do more to, I guess, to kind of help all of us. And that sounds kind of a weird answer, but I guess I'm saying I think that there's hope going forward.
There's hope. Well, I think one thing we're striving for is to get people not to take it for granted that there is water, that it's good quality, and that we can pay for it. So thank you all for your great work. Congratulations to everybody working in this important field. Turning it back over to Irais. Thank you.